Call to order the January 22nd Services Committee. Is there a motion to approve the agenda? Mr. Jeanette, second by Ms. Curran and Mr. Perkins, all in favor? Aye. Any opposed? Agenda approved. Is there a motion to approve the minutes of December 11th? Jeanette and Ms. Curran. Discussion? All in favor?
Aye.
Any opposed? Approved. Our first batch of resolutions tonight is public health. Someone is here? Our first resolution is a lead-based paint. Oh, this is just information, so we'll start information. Wait a minute, someone is right. Okay. Welcome, Mr. Totenhauer, as well. Information you're ready.
So we did just want to bring an update to the group regarding the Lawrence County Legislative investment program. You might know it's a HUD program for the county for lead remediation in homes. This was a collaborative effort through the planning department as well as and the North Country.
Evening all. No, it's been some time since we've had more regular updates and some challenges initially with it, and so it was determined by this board that you would like to see more regular updates. Those ended about a year and a half or so as things sort of came on board more in line with expectations of the program. But just a quick summary, it was an award back in 2018 for $1 million was granted to the county by HUD to do lead-based paint repair or remediation in homes. So this is a process where you go in and have lead-based paint where the children under the age of 6 present. It's of utmost concern to fix those homes just because of the impacts on the children. So the program started in 2018, was awarded in 2018, actually got off the ground in 2019, was then impacted shortly thereafter by COVID, and that was a real challenge for the program, but was worked through. We had a good relationship and worked with our subrecipient to get the work done that needed to be done, and so there were some modifications to the contract as we went along, and an extension that was extended from October of 2022 through October of 2023, and I'm happy to say that all the funds were expended, that all $1 million to assist 23 residences. Back on the.
So while the grant itself was for the entire county, there were some areas in particular that we focused on, just based upon elevated blood levels of the children that we have in our system. So we did focus on WR, Messina, as well as Ogdensburg. There were 25 blood inspections and risk assessments that were completed on 23 units. Cumulatively, these were home to 4 pregnant women, 35 children of the age of 6, 25 children aged 6 to 17 years old, and 3 visiting children under the age of 6 years old. And 2 of the visiting children under 6 and 17 residents of the children under 6 had elevated blood levels. So this money went directly towards removing that exposure in the home. 8 of the units were located within that target area of Offensburg, 2 were in Governor, and 1 was in the target area of Messina. The remainder of the locations were smaller villages in Hamilton County, and 17 of the 24 were built before 19. 5 were built before 1920 to 1945, and only 1 was actually built from 1946 to 1979. So that speaks to the housing stock of our county. There were 7 lead abatement contract trainings, which included 67
Right.
individuals. And
Right.
this
Okay.
and the grant itself also went to support the salary and planning office, public health, as well as the North Country Housing.
The next, there was a report of distribution packet, the next areas and complications. With this earlier, there were program, and probably the biggest was the just the program was geared primarily to urban areas, developed by HUD for urban areas that had a concentration of units that were more the apartment type complex, rather than in standalone residences that, as Carly mentioned, are quite old. The housing stock in St. Lawrence County is quite old. It's quite big. Old wooden farmhouses that have a lot of paint in them, and so that was the challenge, because the initial that led or that HUD put in place was $20,000 for each unit, and that just was not workable for the majority of our units. Of the 23 that we did, we paid 13. We had to get special dispensation to go over that cap, which added to the time process, because we had to confer with our handlers at HUD and get them to understand the process and understand the need here, and housing stock is different from their standard clientele. So that presented a bit of a challenge, but again, that sort of worked out as we went through the process. The other helpful thing that we were able to bring to the grant was some leveraged money. We had another grant that we were able to put money into for specific units that were very high cost units. So we used another grant to leverage the HUD money, the 20,000 HUD, added that additional money, and we're able to get through through some of those higher cost excuse me, units in that matter. But by the end of the program, they realized that, okay, yes, we understand St. Lawrence County is a little different, and they were more open to just giving us a little bit more latitude with the cost of the unit. Other challenges that we faced were the contractor shortage. We had a number of contractors that were initially engaged, excited about the opportunity to work on projects like this, but the pretty onerous requirements necessary to be HUD certified for this specific type of project what was challenging, and also came with a price tag. So there were 2 steps, 2 levels of certification: the contractor itself that's doing the work, and then the individual staff or laborers that work for that contractor. So both of the laborers have to be certified. And Charlie mentioned the trainings that trained 67 individuals. Those were the individuals that could work for a contractor that had the additional certification. So that presented a challenge, still does present a challenge with the amount of contractors that have that extra certification that can do this work. Is difficult going forward. If we were to do this program again, that's one thing that we really want to firm up before we were into it is ensuring that we did have a deep contractor to individuals that had the right certifications to do the work. And then I guess the last challenge, and I also mentioned this earlier, relive it because we were all lived through it, was COVID. Just put a big crimp in a lot of things we all knew about. I'll remember that the just spike in material costs for anything from from standard construction products, sheetrock, windows, things like that, the prices just skyrocketed. And the lead times was just really were problematic, just having to order and wait for product to come in. It was another challenge that we faced with the program.
So, thank you. Now that we've overcome the obstacles, what's the chance of getting any more grant money for this project? And
Yeah, it is certainly possible. I think they have funding rounds that come around usually on an annual basis. So 2024 would have been about 6 months ago or so. Cycle. But I think that the contractor shortage still hasn't been solved. So I really want to look into what type of solutions there might be, looking further afield, Syracuse area. Are they doing these in a batch type of situation where you get a contractor that come up and do 10 units of plants? They have some really strict timeframes. You have to be in and out in 10 days with these projects. So it's really that leads to another complication. You contract with that. They were going to do that. So there's a lot of moving parts to the contractor side of it that we get figured out before we go for the money, because we don't want to have such a slow start again.
fair enough, thank you.
Second.
Thank you, Mr. Chair. I always thought it was only paint. There are other sources of lead contamination. Is paint probably 90% of it, or how do you judge where the is coming from? I guess.
When we run into these problems with state and federal agencies, what is how do you guys go about trying to get the agency to understand what life in rural New York is really all about?
That's a great question, and the answer is
Here's the reason I ask.
Yeah.
Is, I dealt with some of these agencies and, experienced the complete lack of understanding of what reality is north of the freeway. And, but, we do have access to state and federal representatives and to some fairly high-powered folks on the federal level who have staff who familiar with Senator Schumer is the one of the most powerful men in the United States now, and his director of economic development for rural areas is from Ogdensburg. You know, when we run across these problems and we're trying to get HUD to recognize that Northern New York is different from an apartment building in the Bronx, we should keep in mind that, you know, the head of HUD for the part of the US that includes New York State is someone who was hand-chosen by Senator Schumer. And, you know, we should reach out to his staff people in Washington who have the ear of the senator, get us a meeting with the regional director of HUD, you know, to say, hey, you know, tell your minions that there is life above the throughway. And, you know, I think that we spend a lot of time fighting with the minions who have very little interest and very little compassion for the unique needs of Northern New York. And, you know, my heart goes out to both of you in your struggles, but sometimes I think you're too nice, and we need to go above these people, higher up in the food chain, and get someone to knock their heads together and say, stop being stupid and listen to what these people are saying. So, you know, all I'm suggesting is when you run into some of these problems, if you want my help in reaching out to some of these people who I think could help us, let me know. I mean, you know, I mean, this is a political body, but it often seems that we don't make use of the way politics actually works. And, you know, regardless of people sympathetic to the needs of rural areas, we should be going to them and saying, you need to, you know, help us with these guys and or gals or whatever, you know, because I know from my own experience, they can make you nuts. So I'll stop.
Thank you, no, appreciate that, pursue that. And as we were working through this, we did involve a number of different around the ladder of 40 to get where we need to be. It did play out.
Mr. Webster.
Thank you, Mr. Chair. I've heard about the abatements and stuff like that they do in these houses. I'm looking at the years of these houses. I know these houses. They're plaster lots. And I'm thinking that you guys all you do is go in and maybe pull some windowsills down, stuff like that. But it's not. There's doors that are painted, the mop boards are painted. And then I hear you talking about sheetrock. So when you're pulling these boards off, I'm sure that's crumbling. I mean, basically gutting the rooms and redoing them.
There are a couple of different approaches that can be applied, and it depends on the level of paint, how many coats of paint are there, what the risks are. They have a rule that basically it's like a gun that you shoot at a wall to determine whether or not it's hot or not. That makes paint in it. Yeah, different houses, I mean, some houses we spent $20,000 on, some we spent $90,000. And some of those are, were a lot of major. Because the exterior work, as well as interior work that may need to be done if the house is hot with lead on both outside and inside, that adds to the cost. And it's really challenging. So yeah, it can run the gamut of all the.
They don't sand the paint off the woodwork, actually replacing the woodwork, right?
Encapsulation is primarily for woodwork is what they'll do. So they'll cover it, paint it. In some cases, other cases, they will take it right.
So they can paint over the lead paint.
Yes, as long as it's completely encapsulated.
How long is that good for?
For as long as if it's kept in good condition, then that's it can last for a good length of time.
Thank you.
But
How big for the house we that we are trying to restore from age, and we're spending $115,200. Number blows my mind to think that we're going in and repainting, doing various things for a number like that to restore a house that was built years ago.
Right.
Is it worth doing? Is there any limit? The community said that it costs $240,000 to restore. You could do it.
that's always a challenge, because you know, what's the value of the house, right? You never want to put more into the house than the ultimate value of the house. In this instance, when we have kids under 6 that have elevated blood levels and are being poisoned by it, it's imperative that it be repaired. And I know one house was a large house, 6-bedroom house, I think, and there were multiple children living in the house that were at elevated blood levels. So it's difficult once you're there, once you start, you sort of have to finish. And that's where the costs can really add up.
Thank you.
Any other discussion on that? Mr. Dean?
Thank you, Mr. Chair. Yeah, I guess I haven't thought about the value of the value of the home, is actually increases. So what is in place? Say if I had a home and had it remediated, up the value, and I decide to sell it.
Yeah, that's a good question. There are a process, a note and mortgage process where there's a limitation on selling it for 3 or 5 years, depending on how much, I think that depends a little bit on how much you put into it. And there's a sliding scale that if you, that you'll have to pay back some of that if you sell it for a certain the time it's expired. So there is some protection, but yeah, that is an issue. That's why that's standard.
Mr. West?
Are these private residences or are these rental units too?
Can be both. I don't think we did any in this project. I think they were all individually owned residents. But if they were a rental unit, then we would work with the landlord. And the requirement is the intent is to ensure that children that live there are free from lead poisoning. So there would be a requirement that the tenants rent to families with children, if there was money invested.
Thank you.
That's great.
Just a quick question. Probably should know this. Don't we get these properties before we allow them to be rented? isn't there a new law that you have to have mandatory lead testing for rentals?
I'm not familiar with.
I believe that's a New York State program that's being piloted in the southern area of the state.
Okay.
So stay tuned for next season, I think.
Yeah.
Uh,
Are you talking about the lead rental registers? Yeah,
Yes.
so that ends, I don't know. It is something that is being piloted. The higher concentrations of children.
Oh, sounds so innocuous. Any other discussion? Thank you. Our first resolution, actually of the evening, is authorizing the chair to sign contract with providers and organizations. Children and youth with special care needs program for community events. Our motion is current, second by Mr. Jeanette. What?
For this resolution, we're looking for the chair to be able to sign a contract with providers. There are 8 events that are scheduled, we're hoping to be scheduled for 2024, in which will be either speech providers, like psychologists, speech therapists, that will be hosting an event for families and their children to come. There's the first event is scheduled for February 27th at the Magic Washington Library. There's going to be an occupational therapist from Claxton who's going to be going over understanding sensory issues in children and adolescents. So with this, we're just looking to be able to pay our providers for the event, and it's by event, it's not per hour. So for those 8 events, it would be $2,000.
Any discussion? All in favor? Any opposed? Mr. Did you have something for discussion on that?
I was just gonna say money well spent.
Yes. Resolution passed. Our next resolution is modifying 2023 budget for public health for the COVID-19 vaccine response plan. Motion, Mr. Jeanette. Karen.
So for this one, it's just catching up our budget and what we have in our budget for the grant. We just had higher than anticipated operating expenses with fringe, salary expense.
Any discussion? All in favor? Any opposed? Passing. Next resolution, community for public health. All right. Did you had one more informational piece about?
I did.
All right.
This is just, we're anticipating a resolution to go next month. We did receive our letter of award for our year 11 incentive money. So this is about $22,000 given to us for the work that we did with onboarding treatment plans in the county. This was for COVID testing. There's actually a really great dashboard on New York State's website that I can absolutely send out to the board later. That gives information about teaching as far as part of the incentive money, it started out with just Sense Messina being onboarded with testing once a week. And from the work that we were able to do, we onboarded Messina for twice a week, including Potsdam, Canton, Pittsburgh, and 7 more. So we were able to include all of our larger wastewater treatment plants. So we're getting a lot of data. And with this, the awards themselves, they range from $4,000 to $34,000. So we had scored a 94, so we were able to get.
Discussion or comments? Thank you. Next on that, Deputy Director, Community Services. Our resolution of the Community Services is authorizing the chair to sign the top BWI 24 plan for New York State Governor's practicing. Fourth lady.
Good evening. So this is just to have the chair of the board of legislators sign the statute DWI plan for 2024. It goes for January 1st to December 31st. And the budget was already approved this last month in December. So this is just requiring a signature.
Any discussion? All in favor?
Aye.
Any opposed? Carried. Updates.
So you have, I'll have the regular community services clinic updates in front of you. It's really the first page. There's been some minor changes, but nothing significant, so to speak, as far as face-to-face or number of visits per 7 hours. The next page, I will provide a little update on the waiting list. The OTP waiting list says it's 12, it's currently at 6. Since this was printed, we have work to bring that down as well. The OTP dollars paid versus the OTP dollars billed, you'll see a pretty significant drop off. They are going from March to September. Keep in mind that the dollar amount includes all of those rebills, right? So every time we're rebilling a service, that dollar amount is going up. So we have worked really, really hard in the last 2 months to get a more solid process where we're not rebilling constantly. And so what's happening now is our 2 medical billers are posting. So what that means is that the payments that have come in from the insurance companies, they're doing that 4 times a week. So while they're posting, they're actually able to see the potential errors that are occurring right then and there to address them, fix it, rebuild the, I want to say rebuild the claim, but fix it. So it's sending out the correct claim versus sending it out, it coming back to us with a denial, us trying to fix it, and then sending it back out. So we've really, really worked hard since October to fix that process and get things straightened around as far as errors.
Mr. Smith.
Lindsay, is there any way that the report could not be cumulative on the rebills, or that you could back out the rebills so that we could get some kind of more accurate picture?
We've tried, we've worked with 1011 to get a report. I think that's been the $1 million question over the course of the last few months to try to get an actual report. To get that, it would all be a manual process. There's no easy report function in our in 1011, our electronic health record to be able to pull that. It would be us literally looking at every single visit, the charge, putting that in a spreadsheet and getting it that way, which is extremely labor intensive.
Just that would be more meaningful financially. In our being able to analyze those reports.
And I get that, and I think we would also like to see that. We just do not have the manpower right now to do that at all. I'm being honest.
You should continue.
All right. So same thing with mental health and substance abuse services. We are seeing a consistent, the weekly billing, a consistent rise in the percentage of bills being reimbursed, which is a positive to us. The last I looked last week, we were like around 60%. So if we started off at around 40, we're up to 60% now with the rate of reimbursement. So we're getting there. It's been a work in progress. The percentage of services provided but not billed, that could be all a combination of peer services or non-billable services that we provide, or if notes are not timely, we are really working with staff to make sure all notes are in timely. With our EHR, there's a lot of, it's very difficult if, so for example, if we're having individuals coming into the OTP and they're seeing 3 individuals or three providers, they're seeing a peer, you're seeing a counselor, and you're seeing a doctor all on the same day. If one of those people accidentally puts in that they saw an individual from 1 to 1:30, and say our doctor wants to say that they saw that person from 1:30 to 2 o'clock because on their clock it says 1:30,
you're not able to do that. You actually have to go to 1:31 to 2 o'clock. So if the doctor doesn't do that, or the peer or the counselor doesn't do that, then one of them is not able to sign the note. So then we have to start going back through and finding out who needs to be adjusted that 1 minute to be able to send that note out. So it's frustrating. It really is. So we've been really working to fix those issues as well.
Lindsay, do you track denials on a regular basis? What are some of the, I know we've asked in the past, but these days, what are the top denials you're seeing and how are they trending? Like the reasons for them?
So place of service was a big one. We had a place of service modifier that we just fixed for telehealth as well as in office. So it was, a 10 code and a 58 code that had to be built into the insurances. So that's a big one. Insurance setup still seems to be a big one. We are keeping track of this in a spreadsheet, so we're able to filter out and see what the most are. I will say that the most of them are related to setup issues, not technical time. So
Like patient registration,
no, the back end setup of how 1011 was built
I see.
that we're still trying to fix. Knock on wood, we should have an upgrade that 1011 has assured us will fix some billing issues.
You mentioned previously about provider certification. Has there been any improvement along those lines?
Provider certification as far as credentialing?
Yes.
Is that what you're asking?
Yes.
So I will say our Medicare application has been submitted and they are reviewing it right now. The issues with it, so I personally, yeah, we are as well. Question whether or not we're credentialed. She's sending all of our list of our providers. We're getting those fixed. So I would say there's been 3 or 4 in the last 2 months that we have definitely fixed as far as credentialing pieces.
Mr. Burke?
Lindsay, the scenario talked about 1 to the 5. Is that Medicaid problems? I mean, is it part of the? I guess I'm trying to figure out where the problem lies and is it fixable? Is it something 1011 could do if it's Medicare or Medicaid? Could they not generate a report like that?
So our old software, IMA, did not have the time because so when you're billing something, it's the length of time that you spend with the individual. So 1011 uses it by the actual time that you put into to the top of the progress note. IMA did not. They just put the total number of minutes that you spent for that individual. So this is a software setup issue. That we've asked 1011, is there a way around this? Can we take that off? Like, what can we do with it? There's nothing we can do. We have to take a little bit of that.
Are we able to change it to like 1 to 159?
Yes. Yes. So you can manipulate you can actually manipulate the time on the progress note. So,
After the fact.
after the fact. But what it comes to is if 2 people have seen that same individual, you have to go figure out which one needs to move it to 1 minute so the next person can, start the very next minute. There's no 30 seconds.
Do you benchmark with other clinics or could you benchmark with other clinics to see what software they're using and is there a better product out there? I know Jay has mentioned that 1011 is problematic and it's if we should be looking at try to have a better software.
I mean, we certainly could research if there's other software that's out there. I mean, to switch EHRs is a big undertaking. I mean, it was a huge undertaking to going from IMA to 1011. And doing that another year or just within, a year and a half after switching. I don't know if that's the best idea. I mean, I know we complain about 1011 and its issues and we're struggling with them. I think we are making some progress with the setup issues that we found. These other nuances, I think we can deal with. I would be very, very hesitant to go to a new EHR right now, just with the amount of undertaking it takes.
Ms. Curran.
As we're making progress to 1011, has it given us any idea as to how much money?
I don't have that off the top of my head, but
Any other discussion on the updates? All right, thank you, Lindsay. Next, we have Commissioner Siebert. Well, sir. So under social services, we have resolution modifying the budget for social services for year end expenses. Is there a motion? Forsyth, seconded by Mr. when you're ready, when you are, sir.
Yeah, what you have before you is a kind of an end of year cleanup resolution. My newly appointed, 3 months later, but newly appointed director of finance and her staff have been working to try and close out the year. With this one, we had some higher anticipated costs, safety net, and not quite as high in preventative. So this is a $9,000 move around to try to clear this up for the end of the year. We will have another budget mod coming to finance next week. It's going to be a little more substantial. But this is the one that we were able to get prepared for services.
Any discussion? Resolution. All in favor?
Aye.
Any opposed? We'll move on to updates.
So what we're trying to get back to what we'd originally, talked about doing in terms of giving you 3 different pillars of the department, whether it's services, eligibility, and finance. Tonight we're looking at finance because it's trailing the end of the 4th quarter. This is kind of a 20,000-foot overview. It's a very basic, take a look at what we're doing. And as we take a look at this, we are more than happy to drill down. If you have questions or things that you'd like to see, things that you're interested in for the next quarter financial, we can add, subtract, whatever you'd like to do. The first, on the top left, county cost percent of budget, basically is tracking at end of year, and realize that these figures are fluid as we are closing out the end of the year. There's going to be some fluctuation up, down in some of these numbers. But as of January 13th, we had spent 87.5% of the county percent of the budget. Now, the county allocation, as you're all probably aware, is about $36.8 million out of a total $76 million budget we had for last year. So this is 87.5% of the county cost was expended over the course of the year as of January 13th. Now that is subject to change as we're closing out, but that's where we are. And the table next to that shows that 87.5% comes out to 33.3 million of the 36.8 million that was allocated for the county cost. The next row on the left, appropriations and revenue, again, shows the $36.8 million. It was the county cost versus it says 70 million, but it's actually a $76 million overall budget. That's what the appropriations are, and that's all of the reimbursements that we get for all the programs that we utilize. So there is a large amount of revenue coming in. The county cost revenue source on the next chart over, that 36.8 million breaks down to, I don't have the color version in front of me, They're all gray. But you can see that there's 22.6 million, 12.1 billion, and 2.1 billion based on federal, state, and local income sources. Bottom left is the actuals by category. That 36.8 million shows, where we've spent all of the money. That's the excuse me, revenue for the county, and overall benefits, contractual, equipment, and personnel. Going forward, if there's any areas that you would like to see us drill down into to break some of those categories down, we could do so. If you'll recall, the first time we presented finance to you, we had a whole bunch of charts that included every different program line that we had, and it was quite extensive and really messy, and I'm not sure how actually useful that is. But if there's anything that you'd be interested in, we'd be more than happy to include that in the next quarter's financial report. And the last chart is again, budget versus actuals of the personnel. In our personnel line, we had budgeted 14.2 million and we spent 12.8 million of that line. So we're in good shape there. And again, that reflects vacancies and different staffing situations we have there. So very brief and 20,000 foot view of finance. Hopefully, if you have some more specific things you'd like to take a look at, we could have a more robust presentation for you in 3 quarters.
Any questions for Commissioner? Right.
Is this the data that you use to plan budget?
We used a lot of different data. We looked at the last 3 years spending and tried to make projections based on that. This information was tabulated as of January 13th, so a lot of this we didn't have during budget preparation. We were using information from the prior, just the first couple of quarters, and trying to project out from that.
Based on the end of the year results, or anything that should be adjusted as far as next year's?
I think that there's probably a few things that we need to take a look at next year, particularly, and you'll see this reflected in the budget model we have coming next week to finance. There are a lot of costs that increase in foster care and institutional costs that we're going to have to look at adjusting the next time we go to budget. As you're aware, the lawsuit over foster care rates went through, so that changed rates midstream for us last year. We also had a large, based on some initiatives from Albany, increase to adoption subsidies, and there was an increase in cost for institutional, and it's very difficult to predict the institutional cost because we're not sure how many kids we're going to have in institutions. One year we might have 9, the next year we might have 18. It depends on the cases that come before us. So those few lines can change wildly over a few years. But I can say that, I think foster care would be the one area that sticks out to me that we're going to need to take a look at. And again, I'll have more information for you that next week at finance. Sir.
Any other discussion? All right. Anything else, sir?
Go Chiefs.
Thank you. I'll hand it off to Ms. Doyle now for vacancy review.
So our vacancy review was a little bit out of sync with the normal schedule due to the organizational board meeting happening when it normally would. So we held that vacancy review for this month on the 9th, and that happened to be the day after operation. So you do have one Department of Emergency Services who will be requesting this evening because we had the opportunity to review those departments at that time. But with that review, we looked at 7 positions. I have categorized on the far side of your summary at the top the reasons, because often we get those requests. What you will see is an equal number being requested to create in the new category and abolish. And you'll see those throughout the course of the vacancy review. The positions that are being requested to be filled, I believe there's only one that doesn't also have one being abolished in its place. But also so that you can see, we talked about retirement, leaving gaps. The board has taken measures to allow for that overlap. in some instances. So seeing those numbers month after month, I think will have some value for you. Currently, our vacancy rate is about 9.5%. In January, we were looking at around 84. We had a number of caseworker positions that are now, as I understand, both filled and being filled. And we're talking around 7 in CPF. So when you looked at, or when you see in your board share, you can track those monthly totals. They're up around 15 right now. And that's as a result of having vacancies, not because those cases are creeping up beyond what's manageable. As those folks finish their training, as they're able to take on cases, those numbers will come back, we believe, back into, not that 15's outside the realm, that's just the top of the number recommended. But those we're watching, those numbers, we're certainly looking at filling positions that the budget created, that the budget allows for, so that process is working its way through as well. But our fill rate is, immediate fill rate right now is 95%. Excuse me, held for 30 days is just over 3.5%, and held or withdrawn currently is just under 2%. So we are trending lower at the current time. If you remember, we do August to August evaluation of this. And we're approximately 20 lower on the year, 5 months in. So if we continued at this rate, we would end up around the 130s as opposed to our regular trend of around 150, 160. So I think that's positive news, even though our months, you know, when I looked at how many positions generally by month we fill, January is a higher month. And that could be a combination of budget positions as well. But that being said, the first department up tonight, if there's no questions, is social services with only one request to fill. Joe?
Good evening again. The vacancy I have tonight is for a casework supervisor, grade B. This is a backfill. Excuse me. The incumbent for this position was actually promoted to grade A. Thank you. That was vacated when Heidi was deceased office. So we were able to keep our talent in-house. This position is kind of vital on the foster care side. It's responsible for a lot of our home finding activities, supervising 5 to 6 caseworkers. Each caseworker has an average of 11 cases right now. So you're looking at 55 to 66 cases going through this particular supervisor, working on biweekly case conferencing and helping us find, identify and certify foster homes, which is a big deal for us right now. And I hope to be a bigger deal for us coming down the future as we try to possibly take more of that into our own hands rather than contract out for some of those things. So with all of that in mind, it is vital that we fill this position so that we stay ahead of the 8 ball. And we don't start running afoul of some of the mandates that we have. So I'd ask your permission to fill this position.
Questions? Okay, thank you, Commissioner.
Thank you all.
Next up will be our Deputy Director for Community Services.
Take the water with it.
You don't want it? No.
3 positions.
Public health wouldn't approve the communal water.
First up is a position requested essentially to create and fill, but I'll have Lindsay expand on that a little bit.
This is for the mental health services coordinator. So this was my previous position, actually. So this person is responsible for SOA for adults and children, as well as also helping with systems of care, and being a point person for local hospitals, psychiatric units for as far as discharge planning. I'm at the point where I need some help as far as, getting into the department functions more, as well as staging and downstream providers. I just do not have the time to devote to SOA.
And so that it isn't confusing, we left this position when the board created the deputy position in 2023. We left this title in the budget, but we did not fund the position, allowing an opportunity for Lindsay to work into the deputy director position, which we haven't had for, I believe, over a decade now, and also determine at what level this position would be needed. And so in the budget, I'm told by payroll, it's active in the budget, but you won't see it in your budget books listed as an FTE. So that's why we're asking for the create. Any questions on that?
Here's people like,
No, we will have to advertise. I will train and continue to supervise, so I'll still be there to offer support. But no one in mind yet.
Did you have your same question?
Okay.
I'm not going anywhere.
We can't-
you know,
we
so-
can't go on.
Right.
Did I miss a hand over here?
Next up is abolish and create.
This is, for a new senior fiscal officer abolishing, the administrative services manager, sorry. So we have had 6 different administrative services managers over the past 6 years. So with, the resignation in October, prior to that, I was already taking on some of those responsibilities, and since October, I continued to take on the supervisory aspects of that position. So we're looking to help create a senior fiscal officer. Certainly, I'm not a fiscal person, but really to support all of our, our state aid, our downstream provider monies that we have, as well as clinic operations for the OTP, the eviction services, and the mental health as far as fiscal functions of those 3 as well.
Questions? Okay, and the last?
The last is to create a senior account clerk. So as I talked about in our update, since October, we've really been working on a new process. Posting and making sure. With that process, we found that we have a greater need for some more support in the account clerk position as far as our billing. So this position would help with the financial aspects of moving money in our OTP, but also help with budgeting aspects, downstream providers, all of the fiscal operations.
Questions?
So what we're more or less doing is abolishing 2 positions and creating 2 positions.
Correct.
Clear.
Any other questions?
Not necessarily about the positions that we're looking at, but just in general, I see on the bottom of the notes, what we're abolishing in the grade in the future, when we have abolish and create, can we just get a similar sheet so that we can see even just the percentage of the funding streams, like what's coming from state, federal, local, like where the reimbursement is and the benefits, are we able to get?
Or the one that's being
The one that's
abolished?
being abolished as well, just so we have it for comparison.
Sure.
Thank you.
Okay, there's no other questions? Thank you, Lindsay. Next up, we have public health. Harley joining us again.
But this position is really technical to the part. And,
This role for us to be including a temporary position, that transition type position, where we bring someone in to learn before the person departs. This is one of our longest tenured employees in the department. I think that institutional knowledge transfer is always valuable as well. That may be occurring. Thank you, Rob. And lastly, from the operations, but reviewed here tonight is emergency services. I think Matt is gonna virtually. Go ahead, Matt.
Good evening, guys. How are y'all doing? I'm here with a vacancy for my deputy director. He resigned. His last day in the office was January 3rd. He did move on. So with this recent, his workload kind of shifted onto me. And as you all know, that St. Lawrence County is the largest geographically county in New York State, serving 52 fire departments, 19 EMS agencies, 13 law enforcement. And with a recent show of this weekend, with between flooding at one end of the county and a couple of major structure fires at the other, it's very tasking for one person to help support these agencies from one to the other. So I'm here asking for an immediate fill of my deputy director position.
Question for Matt?
Mr. Forsythe.
Thank you, Matt. And yes, I did hear you were very busy this weekend. What about a replacement? You got an idea of someone to replace, or you gotta go out on the street, or how's this look?
We have posted, I don't have anybody in mind, but we have posted the position once he turned his letter of resignation in. And so far, as of right now, this morning, I have 4 applicants.
Okay, good. All right, thank you.
Thank you, Matt.
Thanks, guys.
Now, in our county administrator's report, do we not?
We do. Just a few items to give you an update, a few reminders. The first tonight, I have 2 transfer of funds as required in local law C for the year 2011. I, by the board, have been vested with the authority to transfer funds that don't exceed $5,000. The first report to you tonight is for the county clerk's office with an overage in the postage area. A $500 transfer has been made, and in social services, a $3,760 transfer has been made for Medicaid and for prevention and reunification. So there were shortages in those areas. But that, so that you know, allows us the opportunity to go ahead and make that transfer, pay those bills without having to wait for the resolution process. So I think it was in good faith. And then the law also requires that I report to you at our next gathering. Did want to thank both Jason Botenhauer, planning staff, and public health. Carly's newer to it, but the staff really worked hard. I can remember when Legislator Denisha was chair of operations, every month we were hearing from the department on the lead grant because it was a lift and a real challenge and one of our first federal grants. So I appreciate Legislator Reagan's comments about navigating those challenges as we go forward, because we certainly like to see those funds come into the county. We want to manage them properly and represent the program very well, with the confinements that we're probably going to see in our upcoming projects, workforce and held hostage to supply chains. That makes things really difficult to stay within. So a great effort by both of those departments, and I'm really proud that they were able to pull this one out. I really was concerned it wasn't going to work out for us, but they did a great job. So super pleased with that. Wanted to mention to you, certainly Legislator Terminelli's mentioned it before, but the QPR training, the question, persuade, refer, we've gone back and forth a couple times, learning that acronym. But that is in and around suicide awareness, and we are now making that available to all of our employees. There are trainings scheduled for January, February, and March. I've signed up in March to attend. If you are interested, I believe it's about an hour long. I will also, and this is one of the reasons I mentioned it tonight, I'll be providing release time. This type of training are the skills that certainly we need in our work lives, but we need in our home lives as well. So this is something I feel is very good for our staff to attend. They're open and working with their supervisors to sign up for these trainings, but we'd like to make more of these available to our staff. And we're fortunate to have one of our own department heads, Alexa Backus Chase, be our trainer for this. So we're very fortunate to have this available. If you're interested, let us know. We'll make sure and get you signed up. Tomorrow is the first meeting, emergency services, working with our sheriff's office. We're going to have our first meeting to plan the active shooter drill for the courthouse. So that is going to be a date yet to be determined, but we believe starting in this building where we have court security, where we have a number of potential situations that could occur, is the best place to begin. Our hope is once we are able to put this in place and roll out the drill, that we can do that in our other county facilities. So a great partnership here. We're looking to pull the courts in as well and get prepared so that we can execute a drill in 2024. The Buildings and Grounds Committee will again meet on Wednesday. We had a catch-up meeting from the week before last week. We're remaining with our 2 areas of focus being public safety complex renovations. Tentatively looking at a kickoff meeting with contractors on February 1st. So that project will be moving forward here in no time. And the renovation of our courthouse area associated with family court. So those are the 2 primary focuses. Certainly, we're going to be preparing for the roof renovation and replacement project in the March timeframe as soon as weather breaks. And so that also will have some inconveniences attached for folks in and around the courthouse area. So looking to have that group meet again this week. Next week at finance, I just wanted to remind you, you'll see the 4th quarter financial update for the departments. We also would like to bring for your consideration a slight increase to what we've done the last 2 August timeframes, and that's associated with paving. We've been talking for a couple of years now about increasing that overall total. And fortunately, the board's approved the last 2 years an additional 10 miles. And so we're creeping up toward a full extra year if we're able to do that again this year. But in looking at both where we're situated financially and the great need that is our county road system, Superintendent of Highways and I would like to bring to your for your consideration approximately 44 miles. And also to do that in a resolution now to move those funds when we put the bids out for the summer work for 2024. So what we've done in the last 2 years was take a look at our year-end results and make a determination that, you know, come August, we've been able to, and our contractors have certainly helped us, adding on to existing projects. And so when we looked at it this time, we thought about seriously looking at making up some ground. So if we're able to do that, we'll be closing in on 2 years work. We're able to do 44 miles on top of the 38 miles that are planned for this year, plus the 10 miles. We're closing in on significant progress in our county road system. However, attached to that is significant dollars. The approximate cost for this is $4.9 million. Essentially, $5 million would be the ask. And the reason we'd like to bring this to you early on is because it's significantly more work, and we'd like to put it in the bid when the bids go out for the work that's budgeted already. So I'd like to bring that to you next week. We have the roads attached. I believe it hits 13 districts. We've also been able to attach, I think, 4 districts the last 2 years. But the hope would be that if we're able to do this and we perform well in 23 as a part of our results, that in 25, we could do another 30 plus miles, and in 4 years have done an additional 100 miles. Now that's a lofty goal, and understanding that we have to be and preserve our financial security for the county. We look at that very cautiously, but in doing so, looking at and using our 22 results, which is the latest that we have available, our unreserved, unappropriated funds are at 15%. And, you know, that's something we've been after since 2016. And you hear the governor talking about and patting themselves on the back for getting there now. We've been there for a few years, and we're very proud of that. But when you look at the overall total with the reserves that we've created, which now is at 11.3 million, we're actually at 19% if you include the reserves. And so I feel comfortable making the recommendation to you that we move forward and that you seriously consider adding additionally doubling the road miles this year and almost making it 90. You'll see that in resolution form. If you have questions, certainly can share with you the roads that Highway Superintendent has planned, but I would ask that you take the time to seriously consider improving. And then as a reminder, NISAC is the 26th through the 28th of February. If you're able to attend, we have a couple of slots left. So if that's possible for you, let us know. We can get it set up. I want to tell you all, I appreciate you bringing in, those of you that were able to bring your laptops in tonight. We're about halfway through getting folks ready for the training next week. And IT has requested that if you didn't and you weren't able to bring yours in tonight, that you drop it off sometime this week so that they can bring it up and get it prepared so that you're all ready and they don't need to do that next Monday for the meeting. So you're welcome to drop it off in the board office, or we can coordinate direct drop off to IT. But it's really important that we have everybody ready to log in and able to do the training at 4:30 next Monday. That doesn't mean our meeting Monday night is going to be on Civic Clerk. That's going to be your first blush, seeing the system up and running and being able to watch how it's going to perform. Any questions?
Mr. Forsythe.
Thank you, Mr. Chairman. Ruth, a couple of things, and this is going back to the road part,
Okay,
is, do you remember, okay, Mr. Seaver earlier mentioned we recouped about 1.4 million in payroll from unfilled positions in just social services. Do you remember what 2022's numbers were total? Wasn't it around 5 million?
you mean save from positions? I think it was
Yeah.
in the high fours. We
Okay,
can confirm that.
so just with his at 1.2, I'm assuming we're gonna be somewhere in that same ballpark percentage wise. Thank you. So,
And if you think about the trend I spoke to during vacancy, where we ended up in the 150s, that would
Yeah.
generate similar numbers,
So-
depending on reimbursement.
okay. My concern was, first approach, this all gone home. Concern was sales tax.
Sure.
And it came in 80,000 more than what I think we projected for this coming year. That concerns me a little bit. But I do think we have enough reserves to handle this. And I think it's a great initiative if we can swing it to do that and show the people of this county that, you know, roads and bridges are what we're here. You know, so I'll go with it, but I wish sales tax would have been the 82. But,
Agree, agree, that caused us all to take a deep breath, that it didn't come in at our projection. But also hearing that the state's projecting 2.5% growth, I think you heard that today.
Yeah.
You know, I don't necessarily believe we'll see that 2%. We'll probably see that in 2026. We're usually a couple of years behind. But that was definite moment of pause for making this recommendation. But when I look at, as I mentioned, when I looked at the percentage where we are, and also where we're looking to finish 2023, I have confidence in making the recommendation.
Okay.
Great.
Thank you, Mr. Chair. I support. Taking that. And is in the dramatic drop in the number of students at SUNY Potsdam and at some of the other colleges as well. Take a very watch carefully what's going to be happening in terms of our sales tax. You take a couple thousand students out of the village of Potsdam, take tuition, the housing costs they were paying, and the meal costs they were paying. You know, you're talking about like $25,000, and then with the spending money that's, you know, it's more. And then when you roll that over in our county's economy, when you talk about the loss of waitresses, of landlords not having anyone to rent to, you know, it spins around in the economy and has can have a general long-term negative impact, not just on sales tax, but on the entire county's economy. You know, we have not yet seen the kind of dramatic impact I would have expected. But, you know, with inflation and, you know, other factors, it may have covered up some of the impact. But, you know, we're going to be seeing a decrease in the number of staff at a lot of the colleges, as you know, as well as the students. And the, you know, this is going to have a negative impact on everybody in St. Lawrence County, not just these couple of villages. The people who attend the colleges, the people who teach at the colleges, the people who work at the colleges, live in the surrounding communities. And, you know, we're going to see a reduction in the number of students attending our elementary schools and high schools from those families. And, I think we, as a county legislature, need to be, we don't have any way to control this. But, we need to be aware that, when the colleges, start coughing, the rest of us will be catching a cold, so, thank you. Say hi.
Number of jobs. When goes down. And I know when graduation time comes around, every hotel, and I'm sure Mr. Reagan. Logic, people come to graduation. Ask. They, that, secondly, I know when we knew this at one point, could you tell me how many miles you have? Five. Okay, so that's 20%. Okay, here, that's right, good. Thank you.
Yeah, Ruth, when Chairman Forsythe, asked me what I thought about it. And I think it's good, I think it's good if we can do it. My district, was the beneficiary of a number of miles this year. Greatly appreciated. There were roads that really needed the work. A lot of the roads, a lot of the mileage was damage that occurred with the from like. But I think about the hole that we were in back in 2015, the financial hole. And that's I support the concept that I'm not knowing sales tax, we didn't hit the sales tax numbers. Who knows? And I know we can't, it would be wonderful if we had a crystal ball. No folks don't have. But I'm cautious. Cautious on, we don't know what this year's going to bring. We don't know what next year's going to bring. And I don't want to be in a position where we think, man, wish we had held off.
Is there any old business? Oh. First, we'll do committee reports. First, we have Board of Health, legislative current. Yeah.
Well, I asked for the minutes and they sent me October, so I don't have December's board minutes, but I will send them to everybody. Donate them to.
Okay, thank you. CDP Board of Directors, legislative record.
Let's start with the 2024 grant. It was received in late December. Enrollment continues to be a major issue. They are seeking change of scope to that would lower the item, PBS, newspapers. So they're looking to change services. On January 18th, Operation Warmth. That was held with shoes, socks, and children around the town. This was a program that was started by the revolution. Subaru and Chevrolet. It is, and again, it was a very great initiative. Much needed. Neighborhood centers experience a high volume of traffic. With the holidays. There used to be a need for several of the centers. It's not that they don't have sufficient food, they have a challenge in paying the overhead bills. They did receive some help from Ron Seeley, from Cameron, MVP, and CCOM. Dr. Seidel. Need to stay afloat. For the neighborhood center, it's moved across the street. It's now located in Parenthood, larger space, and we hope to have an open house in February. Weatherization program, we're ahead with production, they're doing well. And there was an application that was submitted for some $44,000 grant for 93 units at Riverside Drive. Announcing it will be on January 29th. That's basically it.
Okay, thank you, sir. Any questions from Mr. Brick? All right, Community Services Board, Legislator Hager.
Thank you, Mr. Chair. We did not meet last month due to extenuating circumstances. Our next meeting will be on the 6th.
Sounds good. Then no questions for you, I presume. Office for the Aging Advisory Board, Legislator.
Mr. Chair, we have not met since my last report, and our next meeting is Monday, February 12th.
Okay. Legislator Terminelli, Advisory.
Thank you. We meet quarterly, but I just have to tell you that Alexa sends me a nice little update monthly that I can share with you, even though we don't meet. So I'm thankful to her for that. So a few things. Teen ambassadors did. Okay.
Proceed.
Teen ambassadors met yesterday and worked on developing a public service announcement for the 5-hour free Friday initiative that's scheduled for March 1st. They're advocating for St. Lawrence County to be free of social media and cell phone use from 4 to 9 p.m. on that day. They received a $500 grant from the National Youth Leadership Council to do this. And the youth committee meets again virtually on February 18th at 4 p.m. We have 18 ambassadors that'll be joining Alexa and Adam Simmons in Albany on February 5th and 6th to attend the annual Youth Leadership Forum. And they're able to take the teen ambassadors this year due to a grant funding from the Association of New York State Youth Bureaus. In partnership with Public Health Department, they're offering a 5K-ish. On Groundhog Day, Saturday, February 3rd at Hubleton, Madrid, Waddington, and Colton Pierpont Centrals from 9 a.m. to 10:30 a.m. And there is no registration fee. In lieu of that, they would like everybody to bring a pantry item to donate. And then the Valentine's card drive is in full swing. Homemade Valentine's due to the Youth Bureau by Friday, February 9th. There's great marketing out that can be shared, but if you know anybody that works with youth around the county, just let them know, just to make some great cards. It brightens up our older folks' faces when they get their deliveries over through that week. Our next meeting is February 13th at 5:30. And just to follow up on the QPR training, Alexa trained 11 staff members today at 2:30, and they were very, very thankful. And there are 29 employees that are registered for the next rounds. So being well received.
Thank you. Any questions for Legislator Terminelli? If you can convey our appreciation to Alexa for that.
He's listening.
Oh, perfect. Thank you. Freaking amazing. All right, moving on to old business. Is there any old business that's developed in the last? All right, any new business? Mr. Portland.
Mr. Chair, I just wanted to mention that 2 weeks ago, 2 Tuesdays ago, I took a legislator Lightfoot, Bill Johnson, Bill Reed, another legislator in their chambers about recycling. We wanted to find out about recycling. They make a good amount of money on recycling. We spend a lot on recycling. Trying to see if we can come up with a solution to maybe work together on a couple issues, and I found it very informative. I think. Well, also while we were there, I took note of their brand new audio system, wireless, that they put in last year with cameras. And very impressed with it. I asked them how they liked it. They love it. It's been well received in their community. And I encourage that. I had seen a nice system down very close, and I think we should pursue it. So hopefully we will, because I think we owe it to our constituents to be able to hear us. We're doing this remotely, best reception. Thank you.
You're here. Yes, go ahead.
So to that end, my colleague, the administrator, Hagman, shared with me the expenses associated with it, because that often comes up as part of the dialogue. But also, our IT director, Rick Johnson, has already connected with theirs, and is going on with things. So we'll be looking at that more closely. And tomorrow we have a demo of another system. And we're also looking at some progress is being made.
Mr. Dean,
I'm sorry, this is, old new business, old business.
whatever you.
Yeah, I was gonna bring this up earlier, but I'd like to take the opportunity to publicly commend our sheriff's office, Office of Emergency Services, St. Lawrence County Highway Department, for the work that they did, and everyone else, the work that they did on January 9th throughout power outages. You know, my area, my district was, I think the most significantly distressed area in the county. And I've heard in my journeys around in my district, I've heard nothing but praise for emergency services, sheriff's department, highway department. So on behalf of myself, residents of my district, and I'm sure everyone in St. Lawrence County, thank you.
Yes.
I would add to that, yesterday and this weekend, the same departments responded to some flooding in the Fraser area, as well as some serious structure fires throughout the county. So we'll be looking to do something for those departments this week.
Any other business? Hearing none, is there need to enter executive session?
There is for litigation, for personnel, which is the medical, financial, credit, or employment history of a particular person or corporation, matters leading to the appointment, employment, promotion, demotion, discipline, suspension, dismissal, or removal of a particular person or corporation, and a significant number of appointments.
Is there a motion to an executive? Today. Right, thanks. Motion to adjourn, Ms. Curtin, seconded by Mr. Fay. All in favor?
Okay.